If you're over 60 and suffer a heart attack while alone, knowing what to do in those first minutes can save your life. Many seniors never survive a heart attack simply because they don't know these 7 emergency tricks. Surviving a heart attack after 60 isn't about luck. It's about using proven steps that give your heart a fighting chance. Have you ever asked yourself what would happen if a heart attack struck while you were completely alone? It is a frightening thought, especially after 60, when your risk is much higher. Many seniors believe they will have time to call for help, or that someone will be nearby to assist. But the harsh truth is that heart attacks do not wait. The first few minutes are the most critical, and what you do during that time can determine whether you survive or not. The good news is that you don't need to be a doctor or have medical equipment to save your own life. You just need to be prepared, act quickly, and follow a few simple, scientifically proven steps. In today's video, we will walk through 7 life-saving actions every senior must know if they ever face a heart attack alone. These tips are practical, clear, and could make the difference between life and death. So stay with me to the end, because the final steps are often the ones that most people forget, yet they may be the very ones that keep you alive. Section 1. Recognizing the earliest warning signs. The first and most important step to surviving a heart attack when you are alone is being able to recognize the warning signs the moment they begin. Many people imagine a dramatic, crushing chest pain like they've seen in movies or on television. But in reality, heart attacks often start with much more subtle symptoms, especially for seniors. And these early signs are the precious moments your body gives you to act before things turn deadly. For most seniors, it may feel like an uncomfortable pressure or squeezing sensation in the center of the chest. Some describe it as a weight pressing down, or as if the chest is slowly filling with something heavy, like wet cement. Sometimes the discomfort comes and goes, tempting you to dismiss it as minor. But if it lasts for several minutes or keeps returning, take it seriously. Do not second guess it or try to convince yourself that it's something harmless. Other signs may not involve the chest at all. You might suddenly feel short of breath, even if you are sitting quietly without doing anything physically demanding. Some people experience pain or discomfort in the arms, shoulders, neck, jaw, or even the back. There may be lightheadedness, nausea, cold sweats, or dizziness. In older adults and women especially, the pain may feel more like discomfort in the stomach or upper back rather than sharp chest pain, making it even easier to dismiss. Let me share the story of Richard, age 74. He was sitting at his kitchen table quietly reading his morning paper when he noticed a strange tightness just below his collarbone. At first, he thought it might be heartburn or muscle strain, but then he realized he could not take a full breath, and sweat started gathering in his palms. Thankfully, he remembered reading that heart attacks often begin quietly and can feel very different than what people expect. Instead of brushing it off, he acted immediately. That decision may have saved his life and prevented permanent heart damage. The body often whispers before it screams. With heart attacks, those whispers are your only chance to intervene early. Waiting for that classic movie-style clutching of the chest may already be too late. If you experience any combination of pressure, shortness of breath, dizziness, nausea, or unusual fatigue, do not ignore it. Stop whatever you are doing right away. Do not try to power through it or tell yourself it's nothing serious. Recognizing the signs and taking them seriously could very well mean the difference between surviving or not. You cannot afford to gamble with your life in those early moments. Section 2. Calling emergency services. Immediately, once you suspect a heart attack may be starting, the very next step is to call emergency services without delay. Do not wait to see if the symptoms go away on their own. Do not attempt to drive yourself to the hospital under any circumstance. And do not hesitate or waste precious seconds wondering if you might be overreacting. Calling 911 is the most effective, most important action you can take to stay alive. When you call, trained emergency professionals are immediately mobilized and begin preparing even before they arrive. As they drive toward your home, they are reviewing protocols, readying advanced medical equipment, life-saving medication, and the expertise needed to stabilize you the moment they arrive. They are equipped to handle worst-case scenarios, including sudden cardiac arrest, which can occur without warning during transit to the hospital. Every single minute matters in a heart attack. The longer your heart is deprived of oxygen, the greater the risk of permanent damage to the heart muscle. Driving yourself is one of the most dangerous decisions anyone can make during a suspected heart attack. If your symptoms worsen while you are behind the wheel, you could lose consciousness, cause a serious accident, or prevent yourself from reaching care in time. You are not just risking your own safety, but potentially the safety of others on the road. Consider Linda, age 78. She felt a dull ache in her left shoulder, followed by nausea, cold sweat, and dizziness. She briefly considered calling her son, but remembered a nurse's advice. Call 911 first. Family can wait. She made the call, and by the time paramedics arrived, her symptoms had worsened. Thanks to that quick decision, the emergency team was ready to act and likely saved her life. The truth is, you do not need to be 100% certain that you are having a heart attack to call 911. Emergency dispatchers will never be upset if your call turns out to be precautionary. In fact, they would much rather respond to a false alarm than miss an opportunity to save someone in true danger. Keeping your phone accessible at all times, particularly if you live alone, is a simple but life-saving habit. If you experience symptoms that affect your ability to speak clearly, many modern smartphones have emergency call shortcuts built into the lock screen that allow you to call for help with just a few taps. Learn where these features are located on your device and practice using them before you ever need them. When those early symptoms strike, your body may be giving you only a very small window of time. Taking action in those first minutes may determine not only whether you survive, but how much of your heart function you preserve for years to come. Section 3. Chewing an aspirin. Slowly and calmly. After you have called emergency services, one of the most powerful and simple actions you can take to protect your heart is to chew an aspirin. This small tablet, when used at the right moment, has the potential to make a huge difference in your outcome. But the key is to chew it, not swallow it whole, so that your body can absorb it faster. Even if your hands are shaking and your nerves are racing, chew it slowly and steadily. If you have access to a standard 325 mg aspirin, and you know you are not allergic or taking medications that could make it unsafe, this step could significantly increase your chances of surviving the heart attack with minimal long-term damage. Aspirin works by thinning the blood. It helps prevent the growth of the blood clot that may be blocking the flow of blood to your heart muscle. In many heart attacks, a clot forms inside a coronary artery, stopping oxygen from reaching the heart. Chewing the aspirin allows it to enter your bloodstream rapidly, sometimes within minutes, slowing or even partially breaking up the clot before paramedics arrive. Numerous studies have shown that this simple act can sometimes preserve heart tissue by partially restoring blood flow while you wait. Every minute your heart continues to function with improved blood circulation reduces the long-term damage that might otherwise occur. Do not be overly concerned about taking aspirin on an empty stomach during a heart attack. Under normal conditions, you might avoid aspirin without food, but during a suspected heart attack, the benefits of reducing clotting far outweigh any temporary stomach irritation or discomfort. The risk of allowing the clot to grow is far more serious than a short period of nausea. If the only aspirin you have is coated or delayed release, chew it anyway. While these forms are not designed for quick absorption, chewing breaks down the coating and allows the medication to work much faster, which is exactly what you need in this moment of crisis. Let me share Joe's story, age 72. One morning, he felt an unusual tightness spreading from his chest into his neck and jaw. He remembered the aspirin bottle in his kitchen cabinet. He calmly walked over, sat down, and chewed one tablet while waiting for the paramedics to arrive. Later, his cardiologist told him that single action likely spared much of his heart from permanent damage. The doctor explained that the aspirin likely slowed the growth of the clot, buying Joe precious minutes that may have prevented far more serious injury to his heart. If you live alone, you should make sure aspirin is always easy to access in several places around your home. Keep a small supply by your bed, in your kitchen, and even in your purse or wallet if you leave home frequently. Check your supply regularly to ensure the medication has not expired. Let your loved ones know where you keep it so they can help you quickly if needed. In those critical early moments, this tiny pill can offer your heart valuable time to survive. Section 4. Sitting or lying down to protect your heart. Once you have called for help and taken aspirin, your next priority is to protect your heart by remaining still, calm, and relaxed. The goal is simple. Reduce the workload on your heart while you wait for emergency responders. Any unnecessary movement or activity can increase your heart's oxygen demand and potentially worsen the damage already occurring. Sit or lie down in a safe, comfortable position that allows your body to rest completely. Avoid the temptation to pace around, unlock doors, or gather personal belongings unless it is absolutely critical. Even small physical efforts at this stage can place additional strain on a heart that is already struggling to function properly. The ideal position is to sit with your back fully supported, your feet resting flat on the floor, and your arms placed loosely at your sides or on your lap. This posture allows your breathing to remain open and easy, helping your heart maintain a steadier rhythm. If you begin feeling faint, dizzy, or lightheaded, carefully lie down on your side with your head slightly elevated to protect your airway and improve blood flow to your brain. Resist any instinct to tough it out or downplay your symptoms. That kind of thinking may serve you well in other areas of life. But during a heart attack, pushing through the discomfort can be incredibly dangerous. This is a moment to prioritize survival, not pride. Let me share Alice's story. At 81, she felt pressure across her chest and back. At first, she wanted to tidy up before calling for help, but she recalled her doctor's advice. If you suspect heart trouble, sit down immediately. She sank into her recliner and waited. Her cardiologist later said that simple stillness likely prevented a heart attack from becoming fatal. Even while sitting, pay attention to your posture. If you're using a chair without armrests, make sure your back remains supported and upright. Avoid slumping or hunching forward, which can compromise your breathing and increase your heart's workload. The more relaxed and properly positioned your body is, the less oxygen your heart requires, which helps stabilize your condition. Remember, doing nothing is, in fact, doing something extremely valuable. Staying calm, steady, and still gives your heart the best possible chance to maintain function until medical help arrives. Every second you remain stable buys you time and increases the odds that your heart can be treated successfully. Section 5. Unlocking your door for emergency responders. If you still have the strength and stability after calling for help and settling your body, there is one more small but potentially life-saving step you can take. Unlock your door to allow emergency responders immediate access. This simple action may not seem urgent at first, but when time is critical, even seconds can make a difference between life and death. Paramedics are trained and prepared to force entry if necessary. However, every second spent breaking down a locked door delays the start of life-saving treatment. Even a brief delay can lead to additional heart damage or prevent timely intervention if your condition worsens while they are trying to reach you. In certain situations, breaking in can also cause additional risks, including injuries if you are positioned close to the door when it's forced open. By unlocking the door ahead of time, you give emergency personnel immediate access to begin their care the moment they arrive. This may be especially important if your condition rapidly declines after placing the call, leaving you unable to move later. Planning for this simple step beforehand can make a major difference when every moment counts. If you live alone, in an apartment, or within a gated community, it is wise to think through these logistics before an emergency ever happens. Is your front door easy to open from the inside? Is your address clearly visible from the street or hallway? Do you have a trusted neighbor or family member who has a spare key? You may also want to consider installing a smart lock, a coded lockbox, or a remote access system that allows someone you trust to open your door quickly if you cannot reach it yourself. Of course, if walking to your door feels unsafe, or you begin to feel dizzy, faint, or unsteady, do not risk falling or losing consciousness while trying to reach it. In that case, stay seated or lying down and focus on keeping your breathing steady until help arrives. The paramedics will get to you one way or another, but your safety comes first. However, if you are close enough and still feel physically capable of reaching your front door safely, unlocking it is a small but very powerful way to help the people coming to save your life. You are essentially removing one more obstacle between you and immediate medical care when every second matters. Section 6. Using your phone's speaker or medical ID features. In those tense minutes while you are waiting for help, your phone can serve as more than just a tool for calling. It becomes your lifeline in several critical ways. One of the simplest yet most helpful things you can do is switch your phone to speaker mode while speaking with emergency responders. This allows you to keep both hands free, focus on your breathing, and conserve your strength without the strain of holding the phone against your ear. When you are having a heart attack, even small movements like gripping your phone can increase the strain on your heart and make breathing more difficult. Speaker mode allows you to stay connected to the dispatcher with minimal physical effort. It also allows the emergency team to hear your breathing, your movements, and any background noises that may help them assess your condition in real time, even if you become too weak to continue speaking. But your phone can offer even more help beyond speaker mode. Today, nearly every smartphone includes an emergency medical ID feature. On iPhones, it is accessible even from the lock screen. Most Android devices have a similar option. This feature holds vital information that can guide paramedics if you lose consciousness before they arrive. Take Susan, age 79, as an example. She passed out just moments before help arrived. But because she had set up her phone's medical ID, paramedics immediately saw that she was diabetic and allergic to penicillin. That information allowed them to avoid treatments that could have made her situation worse. They also used her emergency contacts to quickly notify her daughter. Setting up your medical ID takes only a few minutes, but could save your life. Include your name, birth date, major medical conditions, current medications, allergies, and at least 1 or 2 emergency contacts. Even if you are not very familiar with technology, ask a family member or friend to help you set it up. In moments of crisis, when you may not be able to speak for yourself, your phone can silently deliver the information that may protect you. These features are not just for the tech-savvy. They are for anyone who wants to give emergency responders every possible advantage in saving their life. Section 7. Slowing your breath to steady your heart. During a heart attack, your mind may begin racing, your chest feels tight, and fear can start to overwhelm you. But in these moments, you still have one incredibly powerful tool at your disposal: your breath. Controlled breathing will not stop the heart attack, but it can help prevent your condition from worsening while you wait for help. When fear takes over, anxiety can cause your heart to beat even faster, further straining your already stressed heart. Slowing your breath can help lower your heart rate slightly, stabilize your nervous system, and keep your body from spiraling into full shock. You do not need any special training to use this technique. Simply breathe in gently through your nose for about 4 seconds. Hold your breath for a brief moment, then exhale slowly through your mouth for 6 seconds. Repeat this rhythm over and over, staying focused on nothing but the gentle pattern of your breathing. Frank, age 83, once found himself in this exact situation. As the pain grew in his chest, so did his fear. But he remembered a breathing exercise his doctor had once taught him. He closed his eyes, focused on his breath, and repeated that calming rhythm. By the time paramedics arrived, his heart was still unstable, but it had not gone into full cardiac arrest. Later, he told his family, "I just kept repeating to myself, 'Stay calm, stay alive.'" You can practice this technique even when you are not having symptoms, so it becomes familiar to you. The more comfortable you are with it, the more easily your body will return to this rhythm when you need it most. While breathing cannot reverse the blockage causing the heart attack, it can slow down the effects of panic, help maintain oxygen circulation, and give your heart a better chance to hold on until professional help arrives. In those critical minutes, slowing your breathing may not seem like much, but it can make a real difference. It is one small thing you can control in a moment when so much feels beyond your control. Final thoughts. At the end of the day, surviving a heart attack while alone is not just a matter of luck. It is a matter of being informed, prepared, and taking calm, purposeful action. Each of the 7 steps we discussed today may seem simple on their own, but when combined, they form a powerful chain of actions that can dramatically increase your chance of survival. First, recognize the warning signs early. Do not dismiss strange discomforts, shortness of breath, dizziness, or nausea. Treat any unusual symptoms seriously. Second, call emergency services immediately. Do not try to wait it out or drive yourself to the hospital. Third, chew an aspirin if you have one, and it is safe for you to do so. This small pill may buy your heart precious minutes. Fourth, sit or lie down to conserve your energy and reduce strain on your heart. Fifth, if you feel steady enough, unlock your door to allow emergency responders faster access. Sixth, use your phone's speaker mode and ensure your medical ID is set up ahead of time so that vital information is readily available to paramedics. Finally, control your breathing to steady your heart and calm your nervous system while you wait. Each of these actions buys you a little more time. Each one gives you a little more control over a terrifying situation. And most importantly, they remind you that even when you are alone, you are not powerless. You have knowledge, you have tools, and you have a plan. Thank you for spending this time with me. Your support encourages us to continue creating content that informs, empowers, and inspires you. If you found this helpful, please like, subscribe, and share it with others. Together, we can help more people stay safe, even in their most vulnerable moments. I look forward to seeing you again in our next video.